Hey everyone, I just wanted to talk about a stretch that I recently gave a patient I thought was really beneficial for the front of their shoulder. She had a subscap repair and an anterior labral repair, and she still had loss of some external rotation range of motion. She was feeling a bad pain and stretch in the front of her shoulder, and anytime I tried to stretch her out, her humeral head would slide posteriorly because it would hit a wall in the front of her shoulder, and we could never really isolate the stretch in the front. So what I did, I put my hands on the posterior aspect of her shoulder, so right on the humeral head, and I gave her a nice stretch in that fashion. So what she can also do is put a ball back there to kind of prevent the humeral head from sliding back, or like she's doing, she has her roommate, or her boyfriend actually, put his hand back there, and she uses a golf club to stretch out the shoulder joint in this plane. So I think it's a great stretch to isolate the front of the shoulder. I think this is what we see in people after a surgery. They lose anterior capsular mobility, especially in a labral repair. So I think if we can better isolate the stretch in the front and prevent the humeral head from sliding back by basically creating a buttress somehow, I think that's going to be the best way to stretch that out. So check that out, try it on your patients, and comment below and give me some feedback on what you think of the stretch. Thanks.